Welcome to Fridays with Anne. This is a series of conversations with Belgian homeopath Anne Vervarcke about homeopathy. I will ask her curiously whatever confuses me in homeopathy, like case taking, case analysis, or theory in general, and Anne will answer according to her insights, experience, and most recent findings. You, the viewer, are invited to participate actively, so please feel free to send in comments and questions. For more information on Anne and her work, please follow these links, which will also be posted below every video. And now today's episode of Fridays with Anne.
Hello, it's Friday, and I'm here with Anne Vervarcke. Hello, Anne.
Hello, Jost.
Last Friday, we spoke about what to do with information that the patient relates to us in his various stories, which will fill probably the bulk of the consultation, and how we can make use of this information. Since the patient doesn't give us clear rubrics normally in this section of the interview, we are kind of forced to interpret what he's saying. Interpretation, isn't that kind of a tricky part in homeopathy?
It is. It's unavoidable, but yeah, you're right. Yeah, because we should all come to the same conclusion.
Yeah.
We should all interpret more or less in the same way, and it would all, ideally, would all lead us to the same conclusion. But you know, as well as I do, it very often it doesn't.
Yes. Yeah. So what can we do?
What can we do? Yeah. So the interpretation of the whole story is not on an emotional level. That's the first thing. Of course, the emotions conveyed to us, shared with us, are important. But let's say they are like they accompany the story. It's not the story in themselves, in itself. It's not the sensation in itself. It's like the intensity or the effect on the patient, and we don't prescribe on that. We try to like trace it back to where it came from, what gave rise to this feeling, and that is an experience, and that's a little bit difficult, and some non-homeopaths, you know, actually don't have this concept. We have a concept, or a philosophy if you want, but we have a concept in our minds that the sensation is first, the state, you can say the state of the patient, the way you are, the way you experience yourself is first, and then the stories come later, in a sense that things happen in life, whatever, things happen, and they reflect to you how you feel, what your state is. It's not so much the happening in itself that is important, but what it does to the patient. And what it does to the patient is what he already was feeling before the happening. But that's a little bit, the patient doesn't know. The patient think that the happening, the event, is the cause of his feelings.
Right.
And we as a homeopath, we should...
And other therapists will think the same, right?
The therapist would think the same. Yeah, and it's like we ingrained with this kind of thoughts with cause and effect. They sound so logical. Something happened, that's why I feel upset. Somebody said something, that's why I'm sad. It's not like that. It's a sadness, that's a reaction to some happening. But the sadness must be in you, otherwise the happening can't trigger it. Unless it's, and of course this is, we all understand, this is beyond discussion, unless it is something so common to all humans. You lose a loved one, it would be very strange if you wouldn't be in grief, if you wouldn't be sad.
Yeah.
So that's in proportion, it's a human reaction. It's, everybody would more or less have the same emotional reaction, not the sensation. The sensation will be different, even if a loved one this is deceased, but the emotion will be more or less the same. Somebody is, how to say, is attacking you, is aggressive to you,
Mm-hmm.
many people, the feeling will be the same. Yeah? The feeling, not the sensation. So,
Right.
but a homeopath, we should discern, try to discern. This is common to all humans. This is an appropriate, expectable emotional reaction to a happening, and this is what was first, and that the happening triggered in you. That wouldn't be triggered in somebody else since he's in a different state.
Right. And that's also the reason why the patient will tell this particular story
Yeah,
as the cause.
exactly.
Yeah.
Yeah, yeah, exactly. Because this particular happening managed to trigger the state, yeah, a particular sensation, but it will be covered up, it will be explained by emotional words and feelings.
Mm-hmm. Mm-hmm.
But it's not easy, because as you said, the
Yes.
psychotherapy, psychotherapeutic analysis is something completely different.
Mm-hmm. Yeah. And more patients are kind of getting some insight into this field as well, or are becoming familiar more with psychological terminology and their way of thinking, and that makes it even more difficult.
Yes, we have to listen to all that, and part of it is part of it is rationalizations about their state of feeling. They think
Mm-hmm.
about the reason why they feel.
Yeah.
They feel the way they feel. That is what a psychoanalysis, the psychotherapeutic interventions try to manage the different ways, but they try to get some insight in the why you feel the way you feel, which
Yeah.
for us is not even the reason.
Yeah. Exactly. Yeah. And they also kind of end at their chain of explanation ends at, okay, you feel inferior, or you're sad because you feel inferior in the situation. And
Yeah.
for us, this is not the end. This is not a source of the state in itself, but this is only the beginning, so to say, from this.
Yeah, we would start from there.
Mm-hmm. Yeah.
Being inferior, feeling inferior in the face of whatever. How is it for you? That's where psychotherapy ends.
Yeah. 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 Mm-hmm. So, speaking about this rationalization that the patient might give us, is there any value in this rationalization for us homeopaths?
No, no, it's sand in our eyes and sand in the eyes of the patient. It misleads us because it's an explanation, which is no explanation at all.
Mm-hmm.
So it doesn't explain. It always comes down to father and mother.
Yeah. Yeah.
Let them talk
Yes.
for 3 minutes, and it's my mother didn't allow me to have a rest ever. I always had to do something useful. Or my father was so demanding that even when I had a 9, it wasn't enough. I had to have a 10. It always comes down to flaws of your parents.
Mm-hmm. Right. Yes.
Yeah, denying the fact that you actually chose them, right?
Mm-hmm.
To live out your state and to make your state clear. Of course, you get some imprints.
Mm.
Agree with that. You get some imprints, and will be part of your personality. Yeah, we talked about it.
Yes, because it could also be kind of something that you're just being trained to.
Yeah.
It could be later on that you are being trained the explanation for for your feelings, or you can really be trained in your childhood that this is the way I'm supposed to be, and when this doesn't happen, then I will feel this or that way.
Yes, and the specific. I call it imprints, but you can call it whatever you want. Like specific traits that are typical for this family and in your upbringing. Let's say I don't know, your parents were depressed and they couldn't bear happy children. So you always had to be quiet.
Mm-hmm.
Subdued. Could be. Then this will be part of your personality. You will be inhibited. Like
Yeah.
you won't dare to show your enthusiasm. You know, you're inside by the idea that somebody will be more depressed if I am enthusiastic or something.
Yeah.
But that's part of your, you know, your family habits. It's
Yeah.
not just sensation.
Yeah. Yeah. Okay, so so we're with the patient's story, and we have successfully gone through the rationalization part, maybe of the of their feeling, and we're supposed to interpret then what the patient gives us, because we have to map it onto our system or onto rubrics or onto materia medica symptoms.
Yes. Well, you know what you said, the rationalizations go out of the window. There's nothing we can do with them. So they're of no use, no homeopathic use, let's say. They may be of use for the patient because it gives them inner rest. If you can analyze yourself and you find an acceptable explanation why the way you are the way you are.
Yeah.
Because of your father and your mother and whatever happened. So it gives some peace of mind. You know, you are helped to accept your feelings, which is often the purpose of a psychotherapy.
Yeah, yeah, exactly.
You accept yourself better.
Finding a way to live with your condition.
Yeah, for homeopaths, it's not such a very happy solution because it keeps you in your state.
Yeah.
And it keeps you a little bit further away from trying to get out of it, since you now live with it.
Yeah.
Since you're not so eager to do something about it, since you already did something. You follow psychotherapy, the therapist explained why you feel the way you feel, and you might not get completely rid of it, but you have some peace of mind, more acceptance, and you continue. And all of that is useless for the homeopath.
Yeah.
So there are big chunks of information of the storytelling of the patients we cannot use at all.
Yeah.
And basically we're left with the things we talked about last time, with the not in proportion reactions to happening, with illogical words or sequences, with surprise, also sometimes with the mistakes, you know, there can be a slip of the tongue, but also a mistake that the person says something that makes no sense at all. You can't understand. Mostly are the information you can use, but it's a bit hard to use information you don't understand.
Yeah. Yeah.
But that's how the homeopath actually should train himself to do.
Okay. Can you elaborate a bit more on that?
Yeah, because that is what makes it so interesting. I mean, to be a homeopath first, it's almost like you have a mystery, you know, and you have to be a little bit of a detective. And so the mystery is what you don't understand.
Yeah.
So all the psychotherapeutical explanation you're supposed to understand because they have some logic in them. And as you study the psyche of the human being as well as his physical pathology, you're supposed to know enough about the psychological functioning to know what is normal and not. So all that is for us not very important. It's not very useful. So we're listening for a thing we don't understand. As I told you before, that is surprising. Little surprises or a big surprise, whatever, or very small surprise, it doesn't matter. But something that you don't understand. Why does the patient said this? Why did it said in this particular way? Why this person talks to me in this way? Why does he not answer my question but answer something completely different? What is he talking about anyway? I don't understand. It happens often. And you just don't interrupt. I mean, after a while, you have to ask, you know, I didn't quite understand what was this remark about. Can you explain a bit more? But sometimes it's interesting, more interesting to just sit there, not understand, and try try to see where it will lead you.
Yeah.
And what you can't understand, we know it's a remedy. So your remedy has to explain this particular thing. And to me, that is always a very interesting part of the case.
Yes, of course. So, and this thing then, this is most likely also something which will be hard to put into a rubric straight away, no?
Oh yeah, yeah. And that is probably a little bit of where you said the interpretation danger comes in.
Yeah.
Like you somehow caught it. This is it. But then what is it? What is it?
Yeah, exactly. What is it? I understand it. I can tell it to other people, but how does it fit in my system?
Yeah, yeah. So, and that is where the interpretation comes in.
Yeah,
What we
exactly.
shouldn't do, and that I learned by students homeopaths, what we never should do is you found it. This is it. This is very strange and peculiar of the patient on different levels. This is it, and it looks a little bit like it makes me think of a hawk or something, or I don't know, a hedgehog. So that means we make associations that the
Yeah.
patient make. It makes me think of. And then you have a prescription that has nothing to do whatsoever with the patient, but a lot with you, or probably your imagination. Yeah. So it makes me think of. It looks like that is what we shouldn't do. What might be helpful is that you look at it as you look at the picture. If you look at the picture, you can say, okay, on the picture I see here there's a tree, and then next to the tree there's a person, and there's like clouds in the sky, and there's a little dog here. You know, you see the elements. And what is the overall scene? Yeah. But you don't say, oh, this picture makes me think of having a, I don't know, a free weekend in the Schwarzwald.
This is probably also where the misuse of the sensation method came from, yeah?
Yeah, it makes you think. That means not only you encourage the imagination of the patient to go haywire, but also your own imagination.
Yeah.
The combination of those tools makes funny prescriptions.
Yes, yeah. Very unusual remedies, but maybe not the remedies for the patient.
No, probably not.
Okay, so we're not to embark on our own imagination. But this I like this comparison with the image very much, that we because in that way, if you look at the elements and you get a feel at least for the terrain, so to say, yeah, where it has to be, it will be more and more difficult to go into more detail. And I think that's also where more interpretation comes in, if you go into the details, because you can probably see, okay, this must be from this kingdom. If you look at all the elements, this must come from this kingdom then.
Yes, if you go into detail, normally speaking, it shouldn't become more complicated, but easier. For instance, I call a case because it's a student who gave it for an exam case, and her patient was a boy, 18, 19 years old, and his hobby, more than hobby, was football. And he had a little accident, and that's why he had sequelae of that, and he couldn't play that well or that often. Sometimes he had to be in the reserve and couldn't play. Now, the majority of the consultation was about this, his main complaint, and what his main complaint, how it affected him and his life, and his football was a very important part. So she asked, and very well, she asked, she did her analysis very well. She asked him in all details, not only, okay, you're not so, you don't function so well, because that's what he started off with, and how does it make you feel, and then, and like she insisted to get it to really come to the point. which he did very well. And actually, it was not only I'm not functioning, I can't play. You know, I was in already high in the competition. I'm a young player, and everybody is expecting a lot of me, and I don't like to disappoint people. All that is kind of common. But as he repeated that disappointment was not so much, of course, not in the people, but in himself. And he also made statements like, I rather not play than play bad.
Uh-huh.
And all these little statements together made it possible for the homeopath to understand, you know, it's your self-image at stake. It's not so much your performance, it's your self-image, because he had it also, and we can talk about this later, in other domains which he checked. And it's not so much disappointing the other, but it's like having, how to say, a blow in your respect. Like the people respect you if you failed. Like rather not coming than making a bad performance, rather not playing than having to stop because of your physical ailments, because you had an accident. Nobody will blame you for that. So it's only in him. So by asking carefully, she actually could boil it down to, I don't know what the rubric was, but it was something like need respect, or need something like that.
Yeah.
It's for rubric.
Yes. Yeah.
And of course, typical for the remedy he needs. Typical. It's like the center point of the case.
Yeah. And the remedy was found in it?
Yeah.
Yeah.
Yeah, it was a passer case, passer domesticus.
All right. This happens all the time like this, I'm sure.
What do you mean this happens all the time?
No, I mean that it works like this happens all the time.
Well, not always, but often. If you know what your chunk is, like this is the important part.
Yeah.
And then go into detail that you understand what is exactly the problem. What is exactly at stake? What is it? Then you go a step or two or three steps further. Then okay, this guy had an accident. Now he had a headache or whatever he had. He had a few funny symptoms, by the way. But yeah, you have a superficial case, and he can't play football anymore. No way to prescribe on that. I mean, as Arnica or Nathan Sul or something.
Yeah. Okay, but in your experience, are there many patients who are also capable of pinpointing upon your asking what this core thing is about?
No, they don't know what you're after.
Yeah, exactly. That's the problem. Yeah.
Thank God. Because we had those patients, I think this has a bit overly said. Before they said, my delusion is. They announce it like this. And now we had a period where they came in the consultation and said, my sensation is. And we're losing time. They are losing time and we are losing time, because obviously it's not.
Yeah.
But you have to go through this interpretation of what they perceive as, this must be my sensation. So thank God for patients who don't know what we're looking for.
Yeah, exactly. Yeah.
They don't try to be helpful. The others try to be helpful, but they don't.
Yeah, all right. Yeah. Okay. But in this example, because what also, I mean, this is an example, your example for the situation when a patient focuses maybe the entire session, or is a follow-up, and focuses the entire session on just one situation.
Yeah.
Can you say something about this? How reliable is this then?
It could be misleading. I understand your question. It could be like a local thing.
Yeah.
An accident. He's a football player, like a promising football player, and in his career, this halt, this stop because of this accident. So of course he talks about it at all lengths in the interview, because for him that's the problem. That's it. Accident, sequelae of accident, result. I can't play anymore. That was more or less my life. Yeah, you could say that's a local sensation that he only gets as a result of something, you could say, objective, like an accident, an injury. It's not something in his mind or his state. It's something that really happened. So somebody else with an injury might, in the same situation, might react the same, or more or less. But if you're not sure whether it's local or it's vital, that most likely your patient will tell himself that there are other instances where he reacted the same, or where he had the same feeling. That's the feeling. If he doesn't, then it's up to you to ask, is there anything else? Like, how general can you be? So that's the most general question you can ask. And the patient, no, that's my only problem for the time being. You said, okay, I see, but maybe before. And try to figure out if there was any situation that the patient had the same feeling, or situation or level. If, for instance, maybe he had a childhood disease, or he was in the hospital for, I don't know, 10 years ago for some other reason, and he had the same sensation, then you know it's not local, it's vital. And in this case that we just talked about, he had it the same with his results in school, where he felt that he would lose respect. He had the same feeling, but he projected it. He said, yeah, my parents expect a lot of me, and I don't like to disappoint my parents, and even if I have, like, my points are not so good, I'm afraid to tell my mother, which is nonsense. I mean, we know that. Unless the half of the cases how horrible his mother is, which he didn't tell us. What child would be afraid to tell his mother that his points are not so good? That must be a child that is abused. That would be a child that is afraid to tell it. But with this guy, you could know without asking that it's in him, it's not in his mother. And he waited for weeks to tell her, because he didn't dare to disappoint her. It's his mind, it's not hers. So he had it in another situation, same feeling.
Now a question that comes to my mind is, what then if you have this and you see, this is not your example, but you see that the patient comes up with a different sensation or with a different reaction in another situation. So you see, okay, it was maybe a local, or maybe this one is now a local.
Yeah, which is also possible. You can check it, and he comes up with a different or no sensation at all. That is also possible, that he doesn't recall any other problem, or it's only in this football. Then unless you have something that goes against it, you will have to use it, because there's nothing else. Or another thing that can help you in your analysis is that it is a quite unusual way to react. Itself is quite unusual, which would not be the case in, for instance, another case that comes to mind, a woman. It's a bit long time ago that I've seen this woman, but I remember the story more or less. It does, the details don't matter so much, but she married and lived next door to her in-laws. And you could expect, she said, it's not so easy, because the gardens are to each other, close to each other, and my mother-in-law walks in my garden, and also she comes by the back door, and she doesn't knock the door, and she walks in and out, and she reacts on how I'm dressed, because I'm more a city girl, and the peasants, she always attacks me for that, because she thinks I don't want to make my hands dirty on the farm. And so she comes in my territory, she attacks my way of behaving, of dressing. She puts me down, you know. She thinks, oh, you're secretary, you think you're better, but you're not. So we had all the words of the animal kingdom.
Yeah.
In my territory, the fighting, you know,
the looks.
the putting down, attack and defend. But you just imagine, you're newly married, you're city girl, yeah, and your parents-in-law are peasants, and they live next door, and the woman indeed looks down upon you because she probably expected for her son a better woman, a better farmer woman, better country girl that could milk the cows instead of, you know, taking her car in the morning and go to some office doing some useless job. So her reaction was not so much unexpected. Yeah, you could expect the things she felt and the words she used to explain that. If somebody walks in your, not only your garden, but also by your back door and stands in your kitchen without asking, it is your territory.
Yeah.
Yeah, it is not so funny. It's not so unexpected. It's not so strange. It's more common. And if it's common, and nowhere else in the case is the fighting, the fear, the looking down upon, the I'm lower or higher. It's just in this particular ongoing situation between two people that can't escape. They can't escape. Eh?
Yeah.
So in that case, I wouldn't trust it. I would check if there's any animal, no matter where else in the case, before I would consider an animal remedy, because it's not enough.
Right.
It's not enough. Even if she says my mother-in-law is the problem she is in her life. She can't get rid of her.
Yeah. And would you at all consider this situation as being part of the remedy then?
Maybe not.
Maybe not.
Actually, the patient got a mineral. I remember she got a mineral because in her physical complaints, she had very mineral-like experiences, and in her fight was just a fight.
Yeah.
It was a fight in her life. Minerals have fights. I told you, plants have fights, nodules have fights, humans have fights, we have fights.
Yeah.
You don't have to be an animal case to have a fight. Yeah. It needs more than that. It takes more than that. She should have had it on another level, in another situation, anywhere.
And ideally something which is not really a fight.
Yeah. For instance, in her physical complaints, we would already expect a hint to an animal kingdom because they have quite specific sensations, animal patients, when they have physical ailments. Because it makes them less. We talked about it. It makes them less in no matter what way, less than another. So the comparison is immediately there, and there was no comparison in her case whatsoever.
Yeah.
Except between the country girl and the secretary, but that was the fact.
Yeah.
That was a simple fact. So we shouldn't prescribe on facts, right? We don't prescribe on as if. I think I have to put this in big letters in the training rooms of all homeopaths. We prescribe on as if, never on facts.
Yeah. I would take this as the closing words for this episode.
Yes.
Unless you wanted to add something, we spoke about how after we have heard the stories, or while hearing the stories of the patient, how we come to information and the difference of or the different facets of interpreting, in what way we can interpret and what way we cannot interpret. And we talked about the local versus a vital sensation that the patient will describe in their stories.
Yeah.
Is there anything you wanted to add to this topic for today?
Jost, I always come down to common sense, you know that.
Yeah.
I might repeat a few more times, but I think we homeopaths should use our common sense all of the time. And by common sense, in this particular topic, I mean what is normal, what is common, and what is not. That is very often a matter of common sense. What you never heard before, what nobody ever told you before, and will never tell you again, by common sense, you can say must be vital.
Yeah, yeah.
So sometimes we look too far. We go to, I don't know what, realms to look for something that is in front of our eyes. And that's by common sense that you can just, as I usually say to my students, when they already give you the spoonful in your mouth, you only have to swallow. Yeah. Patients very often do.
All right, Anne. Thank you very much for the information, for the chat. And we continue next Friday.
Okay.
Until then,
have
a good time.
You too. See you next Friday, Jost. Bye.
Bye.
Bye.